Hello, everyone. All right. Let me go ahead and minimize this. And, yep, perfect. All right, everyone. Hello. Like Jeanette said, my name is Lisa Hamid. I am the program manager who oversees the Reach and Early Psychosis Services, which is a TAH program. I am presenting on behalf of Jennifer Pham, who is the division director and oversees all of the TAH services. So today we're going to talk about transitional age youth programs. And uh-oh. One second, there's an issue with it's not clicking. Let me go ahead and stop share and I'll reshare. Just give me one moment. So sorry. I got it. And everyone can see, correct? Okay, great. So sorry about that. So we'll go ahead and move along. So thank you again. So we're going to talk about transitional age youth services. Our agenda today is to review the system of the Children, Youth, and Family System of Care overview. I'm going to talk about transitional age youth programs, projects, and services. I'm going to touch on our early psychosis programs and projects. Talk about accessing care and what the eligibility requirements are, and discuss some of the impacts, especially over the last fiscal year, and also the current things that are happening right now with transitional age youth programs. We'll also have time at the end to take any questions or comments. So to understand where transitional age youth programs fit, one must first understand the Children, Youth, and Family System of Care. So the CYF, I'll use CYF as an acronym going forward so people are aware that it is Children, Youth, and Families. So the vision is that the CYF system of care promotes healing, hope, well-being, and improved outcomes for all. The mission is to be alongside children, youth, and families in affirmation of the values of cultural humility, inclusion, hope, and equity. Our transformative work is accomplished through coordinated, integrated growth, recovery, and resiliency-oriented approaches. The CYF system priorities include co-occurring disorder capacity across all programs, trauma-informed and culturally responsive system of care, having consistent recovery orientation across all programs, having access to timely services, and equity for unserved and underserved populations. And through this, we use evidence-based and outcome-driven approaches to maximize improvements in health. So as you can see here, there's a chart. This is identifying the entirety of the CYF system of care. If you look from one side to the other, we start on my left side as our least intensive services, so prevention and early intervention, and move to higher intensity as you move across the chart. So the next higher level of services will be outpatient, and then intensive outpatient, intensive treatment and supports, into residential and juvenile facilities. As you can see by the red boxes, the TAY system of care, the TAY services fit across multiple level of intensity of services. And often what we find is that although some programs are not geared 100% towards TAY, they do provide services to those who are TAY aged. And I'll go into more of that as we move along. One thing to note are the two bottom boxes in red. One is that therapeutic behavioral services, or TBS, TBS ID. They're accessed across the continuum, but they cannot be a standalone service. It's an adjunct service. And then that crisis services can be accessed across the continuum of services, including mobile crisis, the post-crisis stabilization service, and the crisis stabilization unit. So what are our transitional age youth programs? So first we need to go over program criteria. So all of the TAY programs require that the youth be young person, ages 16 to 25. They must reside in Santa Clara County. They need to have Medi-Cal or be uninsured. And the services are offered to TAY age clients, their siblings, and their families and or caregivers. So the programs at a glance, we're going to start with our drop-in services. So drop-in services occur across 3 different programs. So there are the TAY drop-in centers, Alcove Palo Alto, and the Downtown Youth Wellness Center. So TAY drop-in centers are a space for young people to receive safe, welcoming, and inclusive services, which may include outreach, engagement, access to basic needs, service coordination, and linkage to behavioral health resources. The unique thing about TAY drop-in centers is that they're co-located across our community system of care providers. So our county partnerships, they co-locate the clinic or the drop-in centers at different clinical sites across the county. Now, Alcove Palo Alto is located in Palo Alto. It's an integrated behavioral health center for adolescents and young adults focusing on prevention and early intervention. The services are for youth experiencing mild to moderate symptoms, and they're all free or low cost and can include behavioral health, peer support, substance use support, psychiatry, medical services, and employment and education services. And then Alcove offers these services through a partnership through BHSD, the Stanford Center for Youth and Wellbeing, Valley Medical Center, and Alum Rock Counseling Center. The Downtown Youth Wellness Center supports youth in navigating and accessing services across the continuum. And it's a safe space for activities, learning, and being a place to socialize and just be. As you can see, the ages are slightly below the TAY age, so they start at 12 and they go to 25. And services can include peer support, mentoring, navigating resources, social activities, psychoeducational activities, and employment education support. So moving forward to our services at a glance, the TAY outpatient continuum programs. These are specific to the TAY population. Services to youth and young adults ages 16 to 25. The TAY outpatient continuum is a coordinated continuum of care, which uses a trauma-informed care approach. And the services can be a range of psychiatry and medication support, case management, individual and or family therapy, linkage to community resources and housing support, and rehabilitation linkage and support. The programs include the following: the TAY outpatient continuum services, and you can see the acronyms here. The TAY lesbian, gay, bisexual, transgender, queer, and questioning outpatient continuum services. The young adults in transition team, which is co-located at Las Plumas Clinic. And the TAY interdisciplinary services team, or TAY IST. So we're going to move into our full service partnership continuum services. So moving up in intensity of service. The full service partnership continuum provides services which are youth guided and family driven. These services are designed for TAY age youth experiencing physical, social, behavioral, and emotional distress. They use a team-based approach and comprehensive services designed to treat and improve mental health symptoms and dysfunction experienced by the TAY client population, their families, and caregivers. Services are all trauma-informed, and they wrap around the TAY youth and their family and are led by a family voice to determine what services are needed. So now we're going to look at some of those overlapping services. So I mentioned that there are TAY specific and then programs that actually provide services to the TAY population as well as other age groups. So there is the CYF outpatient continuum services. So these are behavioral health services provided by both contracted and county operated clinics. They help clients with emotional and behavioral issues impeding their lives. And services are clinic-based, and they include services such as assessment, individual and group therapy, case management, medication support, rehabilitation support, integrated behavioral health, and substance use treatment support. And out through the outpatient continuum, it includes ethnic-specific continuum services that utilize culturally specific interventions and support. So I want to touch on the TBS services, or therapeutic behavioral services. This is the adjunct service that I mentioned in the second or the third slide. TBS and TBS ID are strength-based, individualized, short-term, and culturally sensitive skills taught to the youth along with their caregivers or parents to improve their coping, anger management, and mood regulation skills. These services are available for short term, they're intensive, and they can be home or placement-based interventions. Again, this is an adjunct service that can be added along the continuum of care. Services, and it cannot be a standalone service. Services support children and youth up through age 20. So not the full TAY continuum, but to age 20. And then I need to talk about youth SUT service, so youth substance use treatment services, because there is overlap in providing services for our young people. Youth ages 12 to 21 who are in need of substance use treatment or co-occurring services. Referrals can come from a variety of people, including probation, medical clinics, schools, community support providers, or by the youth or their family themselves. Linkage can occur to other services, including medication-assisted treatment or MAT services. And the services are individualized. They use strength-based, culturally responsive, and developmentally appropriate approaches. Some services that are provided through SUTs would be the integrated assessment, an ASAM level 1 clinical treatment, individual, group, or family therapy, and other evidence-based interventions which are appropriate to that youth's needs. So we talked a lot about the continuum of care and what the programs are. So I want to talk a little bit about the activities offered based on the different levels of care that I've reviewed. So starting with prevention and early intervention, this is what I discussed with the drop-in support. So behavioral health, physical health, substance use, peer support, family support, supported education and employment, service linkage, and care coordination. So lots of supportive services that assist the youth in accessing things that will benefit them throughout the system of care. Moving into the higher level of outpatient, we move into things like individual and family therapy, maybe some medication support, maybe some group work or group support, for the family, for the youth. They receive a clinical assessment and psychoeducation to both the young person and their family or caregivers. Again, service linkage, you can see across the entirety of the continuum, service linkage is a primary support offered. And then offering parent and peer supports, linkage to SUT services, and then the ethnic and cultural based services. And then we move into the intensive treatment and support. So through that, there's family-driven CFT sessions, outreach and engagement of youth and their families. Again, service linkage, which is very important. This one is focused a lot on coping skill development and mood and emotional regulation and behavioral coaching. It's important to know that as part of intensive treatment and support, young people and their families can also receive some of the similar activities that are under outpatient as well. So it's important to recognize the community partners who support TAY programming in Santa Clara County. As you can see here, we have a listing of all of our community providers throughout the county. They're in alphabetical order, and all of them provide some form of TAY service. So they may not have every TAY service available, but they do provide at least some services towards TAY age clients. And then I want to review our TAY BHSC operated services. So these are the clinic locations that offer support to our TAY age population, as well as younger children and those who are moving out of the TAY program. So places include Kidscope, Las Plumas Behavioral Health, Sunnyvale Behavioral Health, the Downtown Youth Wellness Center, Alcove Palo Alto, Alexian, and the care team. So Alexian is the SUTS provider that provides support, and the care team are service linkage staff who are co-located at 5 Valley Health Center sites. So I want to talk a little bit about our early psychosis program and how it fits within the TAY continuum of services. So looking at our programs and project, we have the program called REACH, which is Raising Early Awareness and Creating Hope, along with our Early Psychosis Intervention Plus project. And the combination of those two things are our early psychosis prevention services. The goals of REACH and EPI Plus are to identify youth and young adults between the ages of 10 to 25 at clinical high risk for psychosis or experiencing a first episode psychosis and provide evidence-based interventions to lessen the severity of a first episode of psychosis. The expectation is that our programs and projects are part of the psychosis continuum will improve symptomatic and behavioral functioning, enable youth and young adults to maintain or resume age-appropriate social, academic, and or vocational activities. Programs also want to delay the onset of psychosis or lessen its severity and minimize the duration of untreated psychosis for those who do develop psychotic symptoms. And we also want to increase access to early psychosis prevention and intervention services to our young people across Santa Clara County. The Early Psychosis Intervention Project has the same goals as REACH, but it's a grant-funded project awarded to the Santa Clara County to expand REACH services for those youth experiencing a first episode psychosis. Historically, REACH has been working with those who are only exhibiting clinical high-risk signs, but through this special project, we're moving into creating a REACH continuum of services. The project plans to address service gaps and increase access to early psychosis prevention and intervention services. It's a 4-year funding to expand our current REACH program by 26 participants. We want to enhance the coordinated specialty care model within REACH, which I'll review. And the project plan is to create a psychosis service continuum within the REACH program. So REACH is a collaborative program developed and run by Starlight and Momentum. And together, REACH is committed to providing the following services of education, early intervention, prevention, and treatment. And again, for youth and young adults throughout Santa Clara County who are at risk for clinical high risk for psychosis or experiencing early first episode psychosis. I mentioned the coordinated specialty care model. This is what it looks like. Basically, it wraps around the person, so the client, and provides an interdisciplinary team to support that client and their family through different practitioners. So psychiatry or nurse practitioner, peer supports, a family specialist or advocate. Sometimes there's occupational therapy, education and employment support, and individual and or family therapy and group therapy. So the REACH program criteria, similarly to the TAY programs, but it's ages 10 to 25. So slightly younger to TAY through the TAY population. They must live in Santa Clara County, be uninsured or unsponsored, or Medi-Cal eligible. They need to exhibit early warning signs of psychosis for clinical high risk, or exhibit full psychosis symptoms to be part of our EPI plus FEP clients. The time frame needs a prior diagnosis of no more than 1.5 years. So this is early intervention. And symptoms need to be occurring for at least 3 months and impacting their functioning. This is not a one-time, experience of a bad dream or hearing a voice. This is something that's impacting the young person's functioning. And the most important thing about REACH is to understand that the individual needs to be open to talking about their symptoms and what's going on with them, because the entirety of the assessment tool is based on client self-report and family feedback. So you've heard about all of these wonderful services across the TAY system of care, the CYF system of care. So how do you access the services? Well, first of all, we would call the Behavioral Health Access Center. It's important to know that services are provided to children, youth, and TAY age clients and their families or caregivers with Medi-Cal or those who are uninsured. The first step is that the person to get help would start by calling the call center. And during that time, a trained professional will ask a series of questions and help that person access the correct care at the correct location. And then by the end of that conversation, the young person or their family will receive a referral to the appropriate mental health or substance use service or linkage to another program or provider as indicated. Some people are not Medi-Cal eligible, have private insurance. They can be given the information for their managed care plans on how to access services as well.
Can I ask you a quick question? So are there programs that the youth don't have to have parental approval?
Yes, absolutely. So there is age of consent for behavioral health services. And different, I know there's a county consent process, but they're based on programs as well. I can get that information.
Okay.
Yeah. So the REACH referral process is very similar. They can call call center, but we also have a REACH hotline that is answered by REACH staff at Momentum and Starlight. Either referring therapists or staff can call on behalf of the client at the 1-855 number, or the client and their family themselves can call to access the screening services. we need client consent. So either if the referring therapist or staff is providing the referral, they should talk to the family and the client about the referral happening and not just make, a referral without their knowledge, and obtain some consent to that process. Clients calling in directly, they can consent via the phone call when they're calling the hotline. If the referral is coming from the community or a community provider, they can complete a referral form, which after the screening, they'll receive that. The reach manager will let the individual know, hey, the referrals come in, let's schedule your assessment. Clients calling the reach hotline will complete a phone screening, so the referral form is not necessary. Every client that comes into reach completes what's called a structured interview for psychosis risk syndromes, or SIPS assessment. That is a specialized assessment and certified assessor. To complete that, it takes a few sessions, and this is where we talk about that self-report of what symptoms are happening. And the person is either going to meet criteria, agree for services, meet criteria and decline services, or they don't meet our criteria. So what happens in that process is if the youth meets criteria and they consent for service, they're open with reach. If they meet criteria but are not interested, or they don't meet criteria, we have a clinical care coordinator as part of the county who will actually work and provide individualized care coordination and linkage to appropriate services in the community to prevent gaps and from that youth not being able to access service. As part of the county, we also have crisis support services, so 988. As we know, in September of last year, BHSD rolled out the 988 program. Volunteers provide crisis counseling and service linkage over the phone. And through this process, less than 5% of crisis calls are needing an actual in-person dispatch. So this is to prevent those in-person dispatches that are not necessary. And access to behavioral health and crisis support can be made through the call center. So now that you've heard about all of our TAE services, the system of care, and what the admission and referral criteria are, I want to talk a little bit about our program and service impacts. So as you can see here, this data set is from fiscal year 23. So it goes from July 1 of 2022 to June 30th of 2023. And as you can see, 2,140 young people receive services from our TAE providers. So as part of that, REACH had 134 participants. TAE Outpatient Continuum had 1,161. Youth Substance Abuse Treatment Service had 270. And the TAE Intensive Continuum had 575 clients in the last fiscal year. So these programs are definitely having an impact on our young people in the county. So what are the fiscal year 24 changes? That's where we're in right now. So a lot of these changes have happened with the fiscal year 24 starting. And as you can see, what's being developed is a continuum of services, both in the TAE outpatient, including the continuum of services, in the full service partnership continuum, and then in the REACH and early psychosis continuum. A common trend across all three of these programs and projects and services are that service levels meet the unique needs of the young person, and that they can maintain the same service provider throughout the service across the system of care. So this is trying to prevent gaps in services for our TAE-aged client population. So as part of the TAE outpatient, including the LGBTQ continuum of services, there's been a program redesign for the TAE outpatient continuum and the LGBTQ outpatient continuum. Services will range from prevention and early intervention through intensive supports along the system of care. And it will incorporate intensive supports for TAE clients across all of outpatient programming. Moving into the full service partnership programs continuum of services, this was renamed to the Transitional Age Youth Full Service Partnership Continuum, or TAE FSPC for short, lots of acronyms. The services range from traditional full service partnership to intensive full service partnership support. So there's that range of services again. This also increases the availability of intensive supports for all children, youth, and families FSP programs. All of this is to increase access to care and to prevent interruption of service. And then as part of the REACH and early psychosis programs continuum, Services, again, will range from prevention, early intervention to the outpatient support, so slightly under the full service partnership continuum. It'll increase access to early intervention for young people who are identified as clinical high risk through their first episode of psychosis. Again, all of these changes are going to allow the young person to maintain the same or similar service provider teams. So that way the care is more seamless versus admission, discharge. It's a continuum. So with that said, I want to offer an opportunity for questions. I also want to note our contact information for any of the programs I discussed today or any kind of specifics. For TAY would be Jennifer Pham, the division director. And then I am, again, the program manager overseeing our early psychosis programs. So I wanted to thank everyone for your time.
Any questions?
Is there a criteria list for reach? I've had a couple people refer in the past, and neither met criteria. And as a person referring, it's a little frustrating, especially when you're seeing stuff that's not identified from the phone.
Absolutely. So, like I had mentioned with reach referrals, is that it's client self-report. So if we're dealing with a person who is, not really seeing what's happening as an issue, is like nothing is wrong with me, it's going to lead to some barriers for service because that young person has to have some recognition that something is happening, right? Something is different, maybe causing me some distress. And our assessors are really good at trying to tease out that information. It's not, are you hearing voices? Are you seeing things? It's nothing like that. It's talking about experiences, reactions, interactions, things that are happening around the community, at school and at home. So we really do, as part of REACH, try to screen in as much as possible and get that consent from the client. But oftentimes what can happen is that a youth is maybe further along in their psychosis journey where they do need that higher level of intensive supports, or they're at a place where they're not ready for support. They're not ready for treatment, right? So what our clinical care coordinator does is try to work with that youth where they're at and involve them in whatever supports are available to meet their needs currently. So for example, we recently had a youth who definitely would benefit from REACH. They just weren't ready yet. They were scared of service. They didn't want to attend anything. They didn't want anyone to know they were seeing a doctor. So part of what we did with that youth is, assessed immediate safety risks, right? But we also referred that youth to the Downtown Youth Wellness Center because it's a low kind of intensity of service where it's more focused on, breaking down barriers and socialization and drop-in services, and the youth is actually seeking those services to become more comfortable. But that person is still being checked up on, during that process, right? They're not just closed without referral. So I do understand what you're saying in regards to, referrals maybe not be processed, but what I can say is that we should be closing the feedback loop in regards to those referrals as to why the youth did not meet requirements or the eligibility criteria. I hope that answers your question.
And so that they're automatic transition.
Yes, so all referrals that we receive should be receiving care coordination of some sort. So sometimes if it's a one-off kind of, this is, you don't have Medi-Cal, but you do need support. We have Stanford Inspire Clinic, and they're just given that information, right? But someone who does need linkage into the system of care or to even their managed care plan support does come through our care coordinator. And TAY programs as well, they have a care coordinator as well.
Lisa, do we have any questions online?
Let's see.
Last chance for questions, anybody?
I just want to welcome anyone to email myself or Jennifer if there's any additional questions when you leave today. I know sometimes we think of things and we leave the room. Happy to try to answer those questions or get you connected to the right person, to the right place. So.
Well, thank you so much. I learned a lot. I was like, oh my gosh, there's so much there. So thank you so much.
Thank you.
Thank you. Thank you. All right. So I think that concludes. Yes. Indeed, our presentation today.
The presentation materials are available.
They are online. So you just go to our website, SEC
or bhsd.org, and then go to our partner site. Elisa, if you could, well, we have your name, so we can definitely email you the presentation. And then, but they already posted on our website as well too. You just have to go to training and go to behavioral health sessions, and then the presentation is there. And then once after today, we'll also have the recording as well too, if you want to share it with your colleagues. Okay, anything else? All right, well, thank you everyone. So I'm going to be ending our